Hey everyone, it's Victoria Boone, and I've chosen to talk about the applications of psychedelic therapy and palliative care. For those of you who are not sure what palliative care is, it is care that is provided to a patient with a serious or terminal illness. That's actually why I'm in my car right now. I'm here at Emory with my mom, who is taking part in a clinical trial. 3 weeks ago, I had never heard the term palliative care specifically, and was not aware of what it was. But Mom was assigned a palliative care team 3 weeks ago, and so now I know that they oversee every aspect of a patient's well-being. So it's going to be their pain levels, their blood levels, their emotional well-being. They're there for her to call and talk to, if she's feeling any kind of distress. And they offer an ear to listen. But there are all these ways that they can help. I grabbed several brochures from the office this morning that I thought would be good examples of things that palliative care may offer. So, Finding God in Pain or Illness, End-of-Life Concerns, a Guide for Families, What Everyone Should Know About Palliative Care, Hanging On to Hope Through a Series of Illness, Self-Care for Caregivers, When Someone You Love is Suffering, Responding to Life's Challenges That Are Out of Your Control. So, they are equipped to help you with all these things. They can prescribe anti-inflammatories, antifungals, anti-anxiety, antidepressants, narcotic pain medications. They can refer you to any type of other doctor. You can have brain imaging, you can have body imaging. All these different things are covered in a palliative care team. They kind of know what is going on and know who to send you to, and try to do what they can to make you comfortable for what time you have, to live. So, that being said, that's why I've chosen this topic of psychedelic therapy and palliative care. So we know that psychedelic therapy research hit a lull because of political reasons, and in the 2000s it started again. I forgot, this is where I'm starting to talk about my article. The article I've chosen is The Therapeutic Potential of Psychedelic Substances in Hospice and Palliative Care. It was written by Ana Garcia and Lucas Maia. It was an editorial in Progress in Palliative Care in 2022. So yes, laws and regulations were more restrictive in the 1970s, and then now we know that studies are being able to be conducted now, but there was a lull. So we also know that psychedelics cause illicit changes in perception, cognition, emotion, and that they may evoke peak or mystical experiences. Most of the compounds for the psychedelic drugs are similar to compounds found in plants and fungi, and they've been used for their healing potential for literally millennia, in traditional spiritual and folk rituals. So, in a therapeutic setting, psychedelic therapy may be a useful tool for those with terminal or serious disease because of the nature of the substance. They tend to provoke existential experiences, and they have a psychological impact on your well-being. And they also touch spiritual places that may not be touched by, traditional therapy. All of that may nurture new insights. The article had this to say: by turning emotionally toward fear and feeling, emotionally toward fear and feelings regarding their death, the patients, they often felt less anxiety, more compassion, love for themselves and others, and nurtured new insights. My opinion is that the anxiety that comes along with being terminally ill and under palliative care, or being a caregiver of someone in this situation, is that, yeah, the anxiety is overwhelming. It's everything. It's you have anxiety about driving to doctor's appointments. You have anxiety about sitting in your vehicle and submitting your assignments on time and finals, and you have anxiety about the pain. Will it hurt? When will it come back? Will this be a doctor's report that says I'm gonna live, or will this be a report that says I'm gonna die? So yeah, at the end of the day, I guess one of the largest fears, in my opinion, yes, is mortality. But there's a lot of other factors that that cannot be explained. So once again, that brings me back to the ineffecability of the psychedelic substances. So I also learned today while I was here that they are doing actively studies on palliative care and psychedelic therapy for those palliative care patients here at Emory University Hospital in Atlanta. I'm very excited to see where that takes us. And my last thought is that greater acceptance to and openness to the mystery of death might shift focus from like being overwhelming and anxious to acceptance, to where you can really truly live and enjoy your time that you are living here. So yeah, I hope you enjoyed that, and that's all. Thank you.